that all of you could join us. We have an exceptional speaker today. We're really excited to have her. But first, I would like for the team, the Hub team, to introduce themselves. I'm Janine Gracie. I am project director for the HTRC, and this is a project out of the University of Kansas Medical Center. And so next, we'll have Karen introduce herself.
Hi, everybody. Good morning. Karen Edison, Senior Medical Director for the Missouri Telehealth Network and our Show Me Echo program.
Excellent. Thank you. And Rachel?
Morning, everybody. Rachel Mutro. I'm the Director of the Missouri Telehealth Network and the Show Me Echo program, as well as the State Director for the Heartland Telehealth Resource Center.
Thank you, Rachel. And Evelyn? Is Evelyn not on? I'm scrolling through. How about Robert? No? Okay. So Tim.
Good morning. I'm Tim Davis, Telehealth Manager at Oklahoma State University Center for Health Sciences in Tulsa and the Oklahoma HTRC rep.
Ah, thank you. And Heather.
Good morning, everyone. My name is Heather Hagan. I'm a telehealth analyst at OSU CHS.
Excellent. Well, thank you so much for joining us. I think you're going to be in for a real treat today. So now that we have, a lot fewer people on, I think we have time just to do some really quick introductions. If you'll give your name, your organization, and state that you're from, that would help a great deal. So let's start with Cece. Go ahead and introduce yourself.
Hello, everyone. I'm Cece Vangall. I work with Missouri Telehealth Network and Show Me Echo. We're very glad you're here with us today.
How about Franz Kendall?
Hello, I'm Franz Kendall. I work for Mid-Missouri Area Health Education Center here in Missouri.
Thank you. Jerry.
Jerry Wilmus. I'm affiliated with Northwest Missouri State University and Mosaic Life Care in St. Joe and Maryville, Missouri.
Very good. Thank you. Joe.
Good morning, everybody. Happy Tuesday. I'm Joe Kingsbury. I'm the Associate Director of Operations for Missouri Telehealth Network and Show Me Echo.
Great. Thanks, Joe. Mila?
I'm Mila Cunningham. I'm a retired physician that's on the board for the Bluffs Long-Term Care in Columbia, Missouri.
Wonderful. Thank you for being here. Tariq?
Good morning. I'm an assistant clinical professor in optometry at the University of Missouri St. Louis. Excited to be with you and to learn from you guys. Thank you.
Great to have you. Thank you so much. Lauren?
Hi, I'm a student nurse and I go to the University of Missouri.
Wonderful. Thank you. We have a D. Edwards. No, can't get to it. How about Helen?
I am a retired physician and I volunteer at the Social Welfare Board, a free clinic for indigent people.
Great, thank you. And there's Robert. Robert, you want to introduce yourself?
Hi, apologize. I was having some computer problems this morning. I'm Robert Strauss. I work with Katie School Medicine and with the Heartland Telehealth Resource Center.
Wonderful. And Ray?
Hi, my name is Ray. I am the Director of Health Services here for Barnes Healthcare Management.
Great. There was a Laura. Yeah, there she is.
Good morning, Laura Hepkessel. I'm with the SIU School of Medicine, Director of Telehealth in Illinois.
Great, thank you for being here. Christina. No, can't get to the mute button. Christina. How about Evelyn?
Good morning, I'm Evelyn Nelson. Sorry, I was having some connection challenges. I'm PI for the Heartland Telehealth Resource Center and a psychologist at KU Med.
Wonderful, thank you. Did I miss anyone that wants to chime in and introduce themselves? All right. We really like to be able to identify what state you're from. So if you will just click on your photo or your name in your little square, right click and hit rename. That would help us, and then you can go ahead and put the state next to your name on there. If you can, that helps us out a lot. So when we're answering questions, we know what state you're coming from, and so that we can answer those questions appropriately per state. Just a little housekeeping, we use first names on Echo, so we're all glad that you're here, and we just want to make this as easy as possible for everyone and just as collegial as we can. So keep your microphone on mute until you're ready to speak. If you have a question at the end of the didactic, by all means, we are going to have a robust discussion afterwards and would love to have your input on this. So make sure that when you do want to ask a question, you raise your hand, you're recognized, and then you can go and unmute yourself and ask that question. We really like you to ask the question instead of, putting it in the chat, but if you really, have that burning desire, you don't want to forget it, go ahead and put a question in the chat and we'll try to answer it. But we really do think that this Echo is more robust when we have those discussions and we can get to know each other too. So thank you for that. Everything will be posted on Box. We want you to be able to go in and look at this didactic. We want you to go in and look at any supporting materials from even previous Echoes. So please make sure that you do that. And if you have trouble getting onto Box, then you just let me or Cece know and we can help you get started. Very good. Yes, she is all things to us in terms of helping us with this technology. So we really appreciate it. All right. So why don't we go ahead and get started with our didactic, and I'll have Rachel introduce the speaker.
Okay, I am so excited to have Fay as our speaker today. A couple years ago, I think it was January of 2018, Fay flew all the way from Oregon to Missouri to present at the Missouri Telehealth Summit. And who knew that workflow design could be so fun and fascinating? Only Fay knew that, I guess. So let me tell you a little bit about Fay. She is a senior workflow engineer at OCHIN. She has a passion for process efficiencies. She received training on the model for improvement in project management and is also certified in PROCE change management methodologies. These skills, combined with her sociology, human relations, and business management background, have allowed her to take a pragmatic and inviting approach to conducting workflow assessments and process analysis. Fay currently works for OCHIN and has partnered with the California Telehealth Resource Center since 2018 to work with organizations, document and improve their telehealth workflows. She brings people together and draws out important details to find the gaps and redundancies in a process, allowing her to utilize change management practices to implement and recommend process improvements. She has a bachelor's degree in sociology and human relations from Washington State University. Welcome, Fay.
Thank you so much for having me. I appreciate you all. Let me get my screen shared here and we'll get going. So thank you, Rachel. As Rachel mentioned, I work for OCHIN. We're a national nonprofit health IT organization, and I've partnered with the California Telehealth Resource Center for the better part of 2 years. Oh my gosh, I think it's going on 3 years now. And I love doing all of the workflow mapping work with them and their organizations. And I'm happy to share some of this information with you today. So, excuse me, where are we at? There we are. So as we all know, virtual care is more common now more than ever before due to the pandemic. This has really created a larger need for telehealth services within our clinics. So that means our telehealth workflows need to be well-defined and easy for staff to adopt and implement. I'm a big proponent of mapping your current telehealth workflows and seeing where you can maybe see the gaps, do a little analysis and seeing where you can improve them and make it easier not only for your staff, but for your patients. So during this presentation, I want you to think about how you could possibly start documenting your own telehealth workflows if you haven't in the past, or if there's some new techniques you might pick up today. I'm hoping that by mapping out your telehealth workflows, you can use them as a learning tool to educate your staff and how to conduct your telehealth visits, more efficiently and even more confidently, just so they feel really good about doing that. So today I'll cover 3 main talking points. What is a workflow? Then we'll talk about how you can map that. And then I'll just do a brief review of some of the telehealth workflows that I have mapped with the California Telehealth Resource Center. So this is something that I ask myself every morning. This is an example of a very basic workflow, but what a workflow really is a progression of steps or tasks that make up a work process. So they could be anything from a physical or mental task. It could be making a decision in your head, that would be a mental task, or actually typing something or logging onto a Zoom, that would be a physical task. And these workflows can be performed by various people. You have a patient involved, maybe a telehealth coordinator, a nurse, or an MA, and then the provider. So there are various people. And this happens over time. Sometimes over time is very instant. That decision that sometimes someone makes in their head on whether I'm going to go route A or route B can be instantaneous, but there is a little bit of a thought process involved. So a workflow is a progression of steps or tasks that make up a work process, where a workflow map actually shows a picture of who does what in what order. So a workflow map, we just are mapping out that progression of steps. So here's a few examples. This one is just a current state process. They called it a flow sheet for incoming calls. This one can be a little hard to read. The boxes, there's a lot of words in those boxes. Things are kind of all over the place. Kind of have to really think about what's going on here. So sometimes we like to simplify things. This is a very simple workflow. I don't own a cat, but I used to, so I can understand this thought process very well. But this is a very simple workflow. There's one decision point, 2 outcomes, not much more than that. I think there's a sweet spot right in the middle of those 2 that looks something like this. This here it outlines what it's for, the post-appointment lab visit. And there's 2 swim lanes, as we call them, one for the provider and one for your support staff. But really clearly defines what their tasks are. And we can tell that this isn't overwhelming. This isn't going to scare anyone off, and it's very easy to read and follow. So those are some examples of what a workflow map would look like. So how would we even map one of those? How do we go about doing that? Well, first you want to identify what the process is that you're trying to map. I would assume that in a lot of your instances, it might just be your telehealth process, but that telehealth process may be broken down into even, sub-processes. So there might be a process for the actual telehealth visit, and there might be a process that you have for follow-up or even prep work before the visit, making sure that folks get their labs and things done before the appointment. So those could be 2 separate processes. So you want to really clarify what the purpose of that process is. Why does that process exist? That really helps define conversations and helps steer your staff when you're starting to talk to them about what their processes are. When you really have a clear purpose of why that process exists, it's always a point to reference if you ever get stuck mapping. So you want to identify clear start and end points, and then draw out the tasks or decision points within the process and put them in order. And then lastly, define and note which role. That last point there, I can't stress enough. Sometimes when we just put steps on a paper or even in a how-to guide, we write 1, 2, 3. If we don't really know who is responsible for that, it causes confusion and those things may not actually get done. So we want to clearly define what role is responsible. So these are some very basic workflow map symbols. There's a lot of workflow map symbols out there. These are the ones that OCHIN has decided to stick with. We could have definitely chosen a lot more and gotten really complicated. But as I mentioned, we like to keep things pretty simple. Make sure that it's very clear and understandable. So when we put all those together, we'll see that this is a basic template. Up at the top, we have our example process. Right below it, we have that purpose statement. And that's really where we can all come back to, like, why does this even exist? And then the date updated. I do recommend that workflows are updated at least once a year, or at least reviewed. Things may not have changed, and that's okay. But if things have, we want to make sure it's updated, because these can really be used as tools for training and educating. Maybe just making sure, you know, a new staff member understands their role responsibilities, or even helping new members if there's a confusion on what they're, or existing staff, if there's any confusion on what they're supposed to be doing. So a couple tips here. So we see the roles out on the left, role 1, 2, 3, 4. We want to use the role title and not actual people's names. Even if only one person holds that role, let's say telehealth coordinator is held by Stacy. We don't want to put Stacy's name in there. We actually want to put telehealth coordinator for a couple reasons. One, you could eventually have more than one telehealth coordinator. 2, Stacy may, you know, get promoted, may leave, may win the lottery. Lots of reasons she may not come back. And 3, if she's even just sick one day, we want to make sure that whoever's stepping in understands my role today as telehealth coordinator. These are the responsibilities that I have. When we're mapping, we also, you'll see in a couple of the examples I'll go through here at the end, that we like to use verbs as well. These action words really explain what the task is that needs to be done. That way, again, less confusion. So what I recommend is to, in order to map these, like, how do you actually map these? You're like, Faye, that's great. These look wonderful, but how do I actually get it on paper? Well, the first thing is you want to gather your subject matter experts. Sometimes this is easier said than done. So you can do it a couple different ways. The way that, you know, I think works the easiest for folks is just to gather people and just start putting things on a whiteboard, or even just listing out the steps on an Excel if you're doing virtual. Whether it's virtual or in person, you want to get your subject matter experts. But I would caution against too many people in that conversation. So I've found that the sweet spot is anywhere between 3 and 8 people. Any more than that, there tends to be a lot of side talk and a lot of, you know, misunderstandings and things like this. 3 to 8 people, you can really get down what your current process is, and then take that process or that workflow to your staff and see what was missing. Sometimes it's easier for folks to react to things that are already put on paper than it is for them to visualize a process without anything in front of them. So as I mentioned, when you have your subject matter experts together, you want to start with your pencil and Post-it note. That is the easiest way to do it, a dry erase board. However, I know that with the pandemic, we are in a very virtual world right now. So as I mentioned, if you don't have fancy mapping software that creates all these, that's fine. You can use Word, has some really cool shapes and tools that you can use. I have been known to pull up an Excel sheet and just type my tasks 1, 2, 3 in a column, put the action or the task in column 2, and then in column 3 I put the role. So there's lots of different ways to do that virtually. I think the Excel version is my favorite way, just to get it in there, if you don't have anything like Visio to map your workflows. So the big thing then is your role as mapping these workflows is just to ask questions and get them talking. I like to preface every conversation I have with, hey, you guys are the experts. I'm just here to draw out your knowledge. That is true more than I can ever say. You guys know this better than me. I just like to help facilitate you guys get into a more efficient place. So I like to ask questions like, walk me through your typical telehealth visit, or how do you know when to do that? Who notifies the provider that the patient is ready? How is the provider made aware? Or, you know, who makes a decision? How do they make that decision? Tell me more about. You want to really ask those open-ended questions to make sure that you're getting the full picture. If for some reason, if I'm getting stumped on things and I'm not quite understanding the process that they're talking about, I'll take a step back and I'll ask them to give me a very high-level bird's eye view of the process. So that way I kind of know where we're going and I can ask those questions a little bit more in depth. The big thing here is to watch for assumptions. So sometimes we walk into a mapping process and we're like, oh, we've mapped this a million times, or I live this every day. I know exactly what goes on. And that background knowledge is super helpful. But sometimes we find in these mapping sessions that not everybody is doing things the same way. And that could be good or bad. It may just be that they don't know any other way to do it. Maybe they've never been taught, or maybe they forgot what they were taught. So we just want to make sure that we're asking questions and getting everything on paper. And once everything is on paper, we can talk about what is the best way to move forward. So really the reason why I like going through all of this is as I mentioned before, it really outlines the tasks in the order they're supposed to be in. It minimizes any ambiguity or confusion by identifying who does what. I know very little about adult learning theory. I have very smart colleagues that have told me a lot about it, but they like to say that, providing different ways for people to learn is always helpful. So this is a visual map, a visual document that folks can use to communicate about processes. So it's a teaching tool. So you may have a very detailed document spelling out exactly what needs to happen that could also accompany this map for a very visual person. And as I've kind of alluded to before, I really like the way that workflows help you identify gaps or problem areas. I think 90% of the time when I'm going in and mapping workflows for folks, just the act of getting your subject matter experts in a room and having them talk about the process, they've already thought, they walk out of that room with solutions that they're going to go enact right then and there. Because as they start talking to each other and as they start to see the process actually mapped out in a diagram, they then see the gaps themselves and they're like, oh, it would be so much easier if we just did XYZ instead of PQRS. So no pun intended there. So I really like it for that. I think that, especially for those folks that are visual learners, the maps really help you easily identify those gaps and problem areas. So some long-term success strategies is once we get it mapped, we want it to be a useful tool. We don't want to just map it once and never think about it again, because as I mentioned, they can be used as a learning tool, as a coaching tool. You can help identify gaps, things like that. So you want to designate a champion for any workflow. You could have different champions for different workflows, and that could be different than an owner. So a champion, and so the difference between the two, and they could be the same person in your clinic, but I just want to identify the two different roles. So the champion role is someone that's really promoting the workflow and helping make sure that folks just understand what it is, and they're helping coach people to the right workflow, then the owner is the one that is actually responsible for updating the workflow on a regular time frame. So like I said, I think a year is probably a good amount of time. But if there's been major changes in any sort of, things like the past 6 months with the pandemic, I've updated the same workflow 3 times already in the past 6 months. So there are extenuating circumstances where you might want to update your workflows on a more regular basis than once a year. But our telehealth workflows, like I said, every other month, I think it was updating something. So the other thing too is make sure that they're available in a central location, whether it's an online learning system, a team binder, a wiki, like an internal wiki page. Maybe it's just your shared, drive on your computer, but somewhere where staff can get a hold of it if they need to. It's like, wait a minute, I totally forget what my champion told me. I need to go access that. And then define a communication strategy for updating your staff when a workflow changes. So how are we making folks aware if there was a change to the workflow? So, it could be something like we switched from DoxyMe to Zoom or vice versa. If those controls are a little bit different, how do we update our staff? That's really the thing that that I see the most when I'm mapping workflows is that folks aren't made aware of changes, and they really are. Staff really want to do the right thing, and so they really are working from this, really good place. But sometimes that can have consequences that are unintended, and that's okay. We just need to coach them to the right spot. So with that, some of the workflows, as I mentioned, I've worked with the California Telehealth Resource Center for a couple of years now, and we've identified a few agnostic workflows. So these are EHR agnostic. They're very high level processes. These can actually be found on the CTRC website, and you can access them there, but really you can update them and go from there. This is really just a framework that we provided to those organizations when the pandemic began. Well, they were updated then, as I mentioned. So this is an end-to-end. So as I mentioned, there's a few different processes. We want to keep it somewhat simple, fairly easy to follow. So this is our virtual visit end-to-end agnostic, and the workflow, and the purpose is for a clinic to schedule a virtual visit and for a provider to complete the visit. So end-to-end means all the way from when they get onto the schedule to the provider completing it. And so there's a few key things I want to point out here. Sometimes if there's call outs, so we'll start at the first, let me take a step back. We'll start at the first red start point, the red oval in the support staff swim lane, where they receive a patient appointment request from whomever. It could be the patient, a provider, anyone of your staff, but they receive that appointment request and they schedule it. From there, the patient receives their appointment confirmation and completes any pre-visit check-in. So you'll see the little blue hexagon there, and that indicates, you'll see down at the bottom left corner, an operational decision to be made by the organization. So there could be, it depends a lot on whether your EHR or your virtual visit program even allows virtual pre-check-in. Some folks don't. So by operational decision, that may mean that support staff has to do a check-in over the phone if there isn't something that they can do electronically. So it just walks through the process of, so I just wanted to call that out just so you're aware that you can make little notes. You can definitely make these your own. I would shy away from too many notes. I think one little note like indicates an operational decision is fine. But once we can start getting into 10 notes on a workflow, I would suggest you maybe put those into a user guide that would partner with the workflow. So there's a couple more here. There's conducting a virtual visit. This one's a little different. This is really just for the provider. What we've noticed is the end-to-end workflows are really great at seeing that big picture, but sometimes providers just need to know, what do I need to do to help this patient? What are my steps that I have to do? So that could be one of those sub-processes that I mentioned. And I don't want to run through all of these steps here. I'm sure all of you are very familiar with these. Again, this is just a framework, and you can get these from the California Telehealth Resource Center website. And then the last one we had here is conducting a telephone visit. So another thing that we saw at the beginning of the pandemic is, folks were really trying to scramble to get up and running on doing the virtual visits, but sometimes there was connection issues with the patient, or maybe the organization didn't quite have the software yet. Whatever it was, a telephone visit needed to happen. And so we did actually document a workflow for a telephone visit, just in case these had to be used if there was a problem connecting for whatever reason. We wanted to have that backup so that, again, making sure that staff feel confident in what they're doing, we want to make sure we have every scenario covered. So with that, I thank you for listening, and yeah, I guess now I'll take questions.
Great, thank you so much. That was a wonderful presentation, and we know how important workflows are, and so you gave some excellent advice, so thank you about that. So questions, folks. Do we have any questions that you'd like to ask our speaker? Did we have any in the chat?
Oh, I see one in the chat. So The question was, why do I use the term agnostic? It's just a term that OCHIN has decided to use to indicate a workflow that's not EHR or technology specific. So it's a very general workflow that can be adapted and made more specific for your organization.
All right, very good. And only question in there. Okay, so anyone have a question that they would like to ask as I scroll through and look for anyone who may have a question or a concern, something else that you'd like to ask about the workflow?
I will say that sometimes I get asked what program I used, you know, those last 3 workflows. Sometimes I do get asked what program that is. That is Microsoft Visio, V-I-S-I-O. I think there is a programming license for it, but it is called Microsoft Visio.
Janine, I have a question for Fay. This is Evelyn.
Yes.
We're in the middle of updating some of our processes with school-based telehealth. And so I just wondered if you have any experience with that and any additional tips with workflow.
I'm glad you asked that question. I unfortunately don't have a ton of experience with school-based telehealth. I don't know if anyone else on the call has or wants to provide any updates. Sometimes I like to say I like to facilitate experts so that they get the right information out of folks. I have a lot of general knowledge, but very specific school-based. I think I'd lead you in the wrong direction. So I would let somebody else on the phone answer your question.
You know, your presentation already answered quite a few of the questions, so thank you.
Yeah.
You know, I'm interested in the sort of post-pandemic persistence of telehealth in healthcare providers' practices for, you know, patients for whom it would be the safest and highest quality, vulnerable patients, and patients who don't need to come to the health system, who can easily have their health needs met via telehealth. And some of the early things I'm hearing and indications are the physicians and other healthcare providers who have used technologies that have been what I call frictionless or easy to use, not clunky and counterintuitive. Those people are more likely to keep doing telehealth. And I'm wondering, listening to your presentation, if another thing we should really look at is workflow, because it also seems like the people that I know around the country that have continued or want to keep doing telehealth as part of their practice have pretty well-defined workflows. And it seems like the workflows that they have almost always entail someone besides them making contact with the patient at the front end, you know, and working out any technical issues and getting that early information, and then they come in later. It seems like those people are more likely to keep doing telehealth. And we should, HTRC, we should do a big research project and survey the whole country and see if we can find out what those things are that help with the persistence of the use of telehealth as we move forward.
Yeah, I definitely hear you, and we've experienced that. The technology is I mean, you all know this, technology is the barrier in a lot of instances. And, you know, I've heard of clinics getting really creative where they've had hotspots out in their parking lot if internet was an issue for folks. So at least they're not coming into the clinic, but they're staying in their car and accessing it, the hotspot from their cars. Some folks have even taken that a step further and actually had an iPad that they sanitize in between patients, that the patients can actually use the iPad in their car using that clinic's Wi-Fi hotspot. So those are some of the things that I've heard other folks talk about in trying to address that technology barrier. But yes, I hear what you're saying, Karen. That is, I would love to see the data on the research if you guys get into that. And I see another, oh, I'm sorry.
I said that one of the participants said no questions because you covered everything so wonderfully during your presentation. But I just have a question about what do you think the biggest challenge is in regards to workflow?
So I think when it comes to mapping workflows and actually getting it documented, the biggest challenge is the what ifs. It's like, well, you know, one of the things that very early on I had to learn how to manage was like, well, this provider likes it this way, but this provider likes it this way. That can be a big challenge when you're mapping a workflow. And so then that comes down to culture, you know, the culture of the organization, the culture of the providers, this sort of thing. My recommendation is that we try to map what happens 80% of the time. What is the most common scenario we can think of, knowing that there's going to be outliers. Maybe this one provider just, no matter what we do, they're just never going to do it this way. We can know that, but what do we want new providers to do when they come in? What do we want 80% of our providers that we know we can ask and they can do, and they're willing to do this? What is that 80%? And then for that 20%, that's just, I wouldn't chalk them up as a loss at all. I would definitely try and use your workflow champion to help bring that last 20% along. If it's something like just a provider not wanting to do something or a staff member being very just stuck in their ways. But sometimes those exceptions are because there's something going on. Sometimes when we find something like, well, sometimes it happens like that, but sometimes it happens like this. Those sorts of comments really catch my ear because then I start asking more questions. Well, why is it sometimes you do it this way and sometimes you do it this way? Why is one of my favorite questions when I'm mapping workflows. And you'll find the root cause. And sometimes the reason why things aren't aligning and one person does it a different way is, as I mentioned, training. But it might just be because maybe there's a technology issue. It's like, wait a minute, I don't have access to that. I don't have the security permissions. It's not set up on my computer, etc. So there may be an actual fix that needs to happen electronically or with the technology. And so that sometimes it can, in those conversations, sometimes it can get a little, things can get a little, debate. There can be some debate because people like to do things a certain way. I just like to keep my optimism hat on, and I like to bring people together and say, okay, what if we try it this way? And we'll try it for whatever amount of time we set. And if we're liking the way it works, we'll keep it. If not, we'll try this other way. I think to have that improvement mentality can be really helpful if there's disagreements. Sometimes you may just need to bring someone else in that has a bit of authority and just say, no, we're not doing it that way, unfortunately. But there's lots of ways to go about it. I think before we address any sort of anything, we need to have a conversation on why and find out the root cause. That was very long-winded. I hope that answered your question.
Very good. That was very good. So let's see. As far as questions in the chat, looking, and we just covered the challenge generally. So, we do have, a lot of us have protocols and that type of thing. So, so what is the best way of taking those protocols and then making that map? So you say you use that Microsoft, what was the name of that again?
Visio.
Visio, okay. So the best way to take those protocols and put that in a map would be to utilize a software program that you could do that. And then how do you choose? I mean, you don't want to put too much information in each one of those boxes. How do you condense the information so that people understand exactly what it is? Or is that map something that's just in addition to the protocol that you're using?
I would use it in addition to, just as I mentioned, there's different ways that people learn. I think it's really good to have a stated protocol, but then also a supporting workflow map. Sometimes when I'm mapping a workflow from scratch and I have no idea where it's going or how big it's going to be, I just put everything up on the board. And then I'll go back and I'll clean it up. And sometimes when I look at it a second time, I'll see where the process, quote unquote, like there's a break in the process. Or I'm like, oh, this is actually two separate processes. So that's a way we can kind of look at it. So there might be, like, if your process is really big and you have everything on there from front desk to, you know, your whatever rooming process is, if there is a rooming process, and then your provider, those might be three separate workflows if it's a really big workflow. The other thing I like to look for is individual boxes. Now I'm going to just let you guys in on a little bit of my nitpickiness, but I will share it with you all if in case it's helpful. Those little boxes, in order to make it really easy to read for folks, I don't like to have more than 3 lines of text in the box. Now I'll expand the box left to right if the words are just really long, there's a lot in there, but just to make it easy on the eye, I like to only have 3 lines of text in those boxes. The other thing, the big thing that I like to look at is the word "and." If I have to type a word "and," that "and" indicates to me I need another box. That's another process step. I don't like to see the word "and" unless you're saying, I don't know, get this form and this form. That could be one process box. But if you're saying check in the patient and ask them to have a seat, those are two separate tasks.
Very good. Very good. I think I would tend to get too wordy, and that's the reason the question is because, you know, I just want to make it so specific. But the map is something that you can glance at and you can recall what the protocol. Very good. Excellent. And so you say 3 to 8 people is probably the best way to go about creating these workflows. And you did mention about maybe having someone who comes in and says, no, the buck stops here. This is the way we're going to do it. What kinds of experiences have you had with people kind of going back and forth and not knowing what really, okay, so the contentious argument of the 80-20, like you said, what kinds of things, how can you solve that quickly in a group?
So I like to, things that I've picked up along the way in experiencing this and being very uncomfortable with it. In my 4 years of mapping workflows, I've really only had to have someone come in once from the organization I was working with and have them say, look, we're doing it this way. So I will say it doesn't happen that often. Most of the time, if we preface the conversation with like, hey, we're just trying to get everybody's input, nothing's wrong, we're not going to judge other people, we just want to get everything on paper and then we can look at it and make it more efficient. That if we can lead the conversation with that, sometimes it reduces things. But if we find ourselves in it and we're like, oh man, there's a tiff back and forth, I will actually sometimes people just need to see their words written so that they feel heard. And so I will actually write both. I don't do that too often. I don't, you know, in my cleanup process, I'll try and, you know, take what was happening in the conversation and where we know we want kind of the leadership wants it to go. I'll take everything into consideration to maybe streamline those two discrepancies or work with them, with the organization. But oftentimes, as soon as you write both of them up there and then you go through the process, at the very end, after we've mapped everything out, like, okay, what happens next? And you write it down. What happens next? You write it down. You're writing down all your processes. At the end, you go through the whole thing together as a group. And sometimes in that process of at the very end of your mapping session, you're reviewing the whole process with the group. One of those two people that maybe was having a discrepancy will go, oh, that doesn't make sense the way I was doing it. And then they'll see, and it sometimes folks just have to see the whole picture. So, if there is a discrepancy in that situation, we can really, like I said, ask why, get to the root cause of why folks think and maybe even getting to the root cause the other person will see. The other way is just write down their words and say, okay, why don't we put it here and see what the rest of the process does and we'll come back to it. Those are really the two biggest things that I use a lot.
Great. Well, we always say when we have people decide to implement telehealth that, you know, we have to have certain people at the table. and it's not sometimes your usual suspects, so to speak. So with this group that does workflow, what kinds of other people would you have participate in this process? So of course you're going to have, you know, the clinical people, but shouldn't you invite IT to this conversation as well if you're working with technology?
Sometimes, yes. I've had I think the more variety you have in a group, the better. So sometimes I've had folks in there where it's just the telehealth coordinator and the provider, and we've had to pull in the IT person. And sometimes there's folks' schedules are busy, and there's a lot that we can do with just like the coordinator and your provider, and we can call in the IT person at the end and say, hey, we have this list of questions for you. That might be easier. Sometimes getting a front desk person involved if there's any sort of registration, scheduling, check-in, that maybe is, if you don't have a coordinator or the coordinator is doing something else, get an MA or nurse, whoever is assisting the patient if they're in your clinic, or, and sometimes if I've had folks even do patient surveys to get patients involved in the process, that's a little advanced. When you're just starting out mapping, that may be a little intimidating to get your patient's input, but it's always a good idea.
Excellent. Very good.
I was wondering, Janine, about the folks on the call, if there's any pieces of your workflow in your telehealth service that you think are particularly important or particularly helpful.
Anyone?
Was that to me or to the whole group? Okay, I just want to make sure I wasn't missing something. Okay.
You know, if anybody wanted to share what they found particularly helpful in their telehealth workflow process so far, any of you that are doing it?
Just to clarify, Karen, you're talking about how to map it, or that?
No, just like, if you're doing telehealth now, what piece of it have you found to be most helpful? So when I did teledermatology, for example, what was most helpful for me was when they would take pictures with the mini iPad in the rural clinics, those images would come immediately to my iPad. So I could flip through their skin and then talk to them over video conferencing. That was super helpful. I just wondered if there's any pieces we could share that we really find helpful. You know, I think now that we're taking care of patients in their homes, that kind of raises a whole nother level of issues. And, you know, many patients, we've talked about this before in this echo, really need some direction about how to be on video and how to position themselves and get rid of background noises, like they're building cubicles out here. That's but, you know, and how to look in the camera, to look in somebody's eye. I mean, just a few things like that. I think especially because people are at home, I think patients need a little extra help on the front end than our traditional legacy telehealth services in the past, where they were in clinics more likely, or in critical access hospitals and things like that. So I think that part of the workflow, really having someone reach out to the patient and get them set and get them comfortable. And I think that's a really important part of the workflow now, particularly because people are in homes.
Yeah, I totally agree with you, Karen. That is great. We've even noticed that's some of those same things that you've mentioned have been helpful for providers on the other end, because providers are now working from home as well. And so that scenario can be a little bit different than being in the clinic. So making sure that your patients and your providers are aware of the change and kind of know what to expect.
Absolutely. Very good advice. As I said, been building the bridges, we've been crossing it. So, you know, any good ideas, you know, that you have, please share, because we're all in this together.
And Heather, thank you for putting in the chat. Lucid Chart is a good alternative to Visio as a free version. I had never heard of that. So thank you for sharing. That is great information. So Lucid Chart is a free alternative.
I've had to use it a couple times just whenever we were kind of doing a hierarchy, and I didn't have access to Visio at the time. And I was like, well, Free is always good. So
we've used that one with good success too. It's certainly the more cost-friendly alternative.
Very good. Any other questions or comments from our audience today? Well, that's wonderful. So we're going to practice again what Dr. Edison has always told us, is that Zoom fatigue is real, and it's okay to end a little bit early so that you can get to your next meeting and take a breath or two before. So we just really appreciate Fay's presentation today. I thought it was very good. Thank you for all of that wonderful information. Please remember that this presentation will be on Box so that you can go and look at it again. Our next Telemedicine Echo is 2 weeks from today, the 27th, believe it or not, October 27th. And it's going to be, we're going to address the HIPAA and security. So please join us and tell your friends to come and join us for that Telemedicine Echo. We really appreciate your participation, and we want you to go out and make it a great day. Thanks, everyone. Have a wonderful Tuesday. Bye.